Alright, so I'm going to be giving some postpartum instructions to our new mom and the family. Okay, so first off, for the first 24 hours, always have somebody present with you. Don't try to get up and go to the bathroom or do anything really without having somebody with you. So expect to have sore nipples. It shouldn't be painful. Your colostrum will be present for the first 3 to 5 days. Thereafter, your milk should come in. You might get engorged at this time as the milk supply is increasing. It'll typically last 24 to 48 hours, so just continuing frequent breastfeeding every 2 to 3 hours or on demand as much as baby needs. Expect to be a little bit fatigued and tired, so rest. We always say 5 days in the bed, 5 days on the bed, and 5 days near the bed. So really just kind of lay low, eating lots of warming foods, nourishing foods, lots of water, staying super hydrated, teas, and only really getting up to go to the bathroom and to maybe take a shower, obviously having somebody there. When you do go to the bathroom, you might have some burning, especially if you tore, so definitely use the peri bottle. We have herbs that we've given you in the peri bottle, so you can squirt that while you're peeing to kind of dilute the urine, and always just blot dry instead of actually wiping. That way there's no more trauma that will be incurred. Also using the witch hazel soap pads, peri pads, that are frozen can be super helpful to just reduce swelling. If you're having a hard time voiding, sometimes just dropping a little bit of peppermint oil in the toilet can really help, or running water. Let's see. There should be, it's expected to have a little bit of soreness in the perineal area. Try to keep your legs close together, no sitting with your legs open, or doing any kind of crazy things with your legs. Just stay nice and tucked in bed with your legs close together so that that perineal area can heal quickly. As far as bowel movements, within 2 to 3 days you should have a return to normal bowel movements within the first couple weeks. You might be a little constipated at first. Stool softeners can definitely help. I also have a Chinese herbal formula that's really great for just re-moisturizing the intestines after all of the fluid loss from birth, which can help with the bowel movements. While nursing, you're going to definitely be cramping. As the baby sucks, it stimulates oxytocin, which causes the uterus to cramp. So there's different tinctures you can do, postpartum tinctures for cramping, as well as just warm compresses, like an insulated rubber bag to keep heating pack to keep your belly warm if you're having cramping. Muscle soreness, totally normal, and sweating is also super common within the first few days as your body's getting rid of all the excess fluid. If you do have a little bit of a low-grade fever or rise in temperature below 100.4, that's also normal. Your lochia, which is bleeding, should be kind of red and bright for the first 2 to 4 days, and then it'll turn into a little bit yellowish brown for up to 10 days. Should be completely stopped by 4 to 6 weeks. If you start bleeding more, that means that your body is doing too much. So if you're soaking more than 2 or 3 pads in 20 to 30 minutes, definitely call me. And if your bleeding is continuing to increase as opposed to decrease, that's definitely a warning sign. I always like to show you where your fundus is so you can feel how nice and firm it is. We always want it to be firm. By about 2 weeks, you won't even feel your uterus inside of your belly anymore. Let's see. Hemorrhoids, if they do occur, witch hazel is great. Sitz baths are also really great for perineal healing as well. And, postpartum blues is also pretty common. Your hormones are really dropping at this point after giving birth. Your nipples are sore. There's just a lot of transition happening. So tearfulness, confusion, low mood, anxiety, agitation, these are all normal, but they should kind of taper down by about 7 to 10 days. I feel like this is always enhanced with rest, nourishment, and support. So making sure people that are coming to visit are not staying for too long, and if they are staying, they're bringing you meals and kind of helping you with different things around the house is always going to just help the transition. So I already mentioned heavy bleeding. If you're soaking more than 2 or 3 pads in 30 minutes, definitely call me. If you're having a hard time breathing, if you're having a fever, if you're too weak to get out of bed, if you're having abdominal pain, any chills or pain in your breasts, redness in your breasts, if they're super firm, give me a call. If you have any calf pain or one-sided pain or warmth or heat in your legs, definitely let me know. If there's any really significant mood changes, I also want to know. Any sudden headaches with vision disturbances, also give me a call. And any kind of severe depression or suicidal behavior, also very important to let somebody in your immediate family as well as myself know. Normal newborn babies within that first 4 to 5 day period will typically lose a little bit of weight. We don't want it to go past 10% of the birth weight within the first week. So obviously just making sure we check for the tongue and lip ties to make sure the baby has a great latch and is going to be withdrawing enough milk and expressing enough milk. And if there's any issues, the referral for a lactation consultant will always be available, as well as just different breastfeeding resources if there is an issue. And sometimes supplementation is needed, but typically that birth weight will return to normal by about 2 weeks. Jaundice is also normal. About 50 to 60% of newborns will experience jaundice within the first week of life. If there is any jaundice occurring within the first 24 hours, I definitely want to know. That's considered pathologic, and we would definitely want to get the baby in. Baby might have a little bit of bruises or swelling, caput, or hematoma. Typically, these will resolve on their own if they don't usually hurt the baby. If the baby is lethargic, not feeding well, those are things that we would want to consider if there is a hematoma, just to get baby checked out. And then expect to be feeding baby, like I said, on demand or at least every 2 to 3 hours. So just things to be watching for in the baby, like I mentioned, the jaundice, if there is any umbilical drainage, if it's bleeding, definitely want to know. If the eyes are swollen or start having pussy-like fluid, I definitely want to know. If there's any breathing issues, blueness, we never want to see blueness around the mouth or on the central trunk. It's normal to have bluish tone, color tone on the hands and feet after birth because called acrocyanosis, all of the blood is kind of shunting to the peripheral organs at first. It'll take a little bit of time for those hands to get pink. If the baby's too cold or too hot, definitely let me know. If the baby's having a hard time feeding, if there's any other kind of bleeding or diarrhea, those are also things that I would want to know about. So other than that, everything should flow pretty normal. I'll give you this handout so that you have everything to kind of have at your convenience. You can look over if you're concerned about anything. You'll have all the warning signs printed out and when to call me, as well as just normal stuff to expect.